Hello, I'm Dr. Elizabeth Wako, the Chief Exec for Swedish Seattle. As we face a record number of COVID-19 cases in the Puget Sound, it's important for us to be transparent with our community about the state of healthcare in our region. King County has seen a 97% increase in COVID-19 cases, and we've seen a 94% increase in hospitalizations in the last 7 days. So at Swedish, our cases are up over 5 times what we were in December. And we know that Omicron is highly transmissible and the dominant strain of COVID-19 in the nation today. If you look at our data from South America, science is telling us that Omicron will likely peak at the end of January. So while we may have more weeks left in this surge, we do know how to tackle this problem. First of all, being vaccinated and boosted works. Vaccines help protect you and your loved ones against severe disease and, in most cases, hospitalization. Right now, about 22% of the patients in our ICU have COVID, and of those patients, approximately 62 are not vaccinated, or 62% are not vaccinated. So we're asking the public, please, if you can get vaccinated or get your booster shots, please do. We also know that continuing to take precautions work. So get tested and quarantine. If you're symptomatic or you've been exposed to someone who has tested positive for COVID-19, please quarantine. Also, keep wearing your masks and practice social distancing and follow our local public health guidance for safely gathering. If you take these measures, that will help protect yourself and your loved ones and our healthcare system. So while we know we've got this, there are some pain points that are straining our healthcare system and our teams. One of the biggest pain points is we have a math problem. With Omicron surging in the Pacific Sound and more people needing our help, at the same time, Omicron doesn't really discern between healthcare workers and you. So we're being hit hard with our caregivers who are out sick, unable to care for the large number of patients who are coming in who need our help. So in light of that, we've had to make some tough choices around cutting back on much needed surgeries. And right now, we're running at about 40% of surgical capacity. We're doing all we can to continue to provide high quality care for our community. Our governor has partnered with us by helping put in some supports to help get patients discharged from the hospital. And we're utilizing agency staff, including nursing. And if necessary, we'll consider the updated guidelines from the CDCs on how to get caregivers back to work and safely and quickly as possible. So please be assured that our teams and our community partners are monitoring this fluid situation minute by minute. And we've got this. We'll make it through this surge. We just need a little help from you. So remember, get vaccinated or boosted, get tested, but avoid the emergency departments for testing. Instead, find a site near you using doh.washington.gov. So mask up. And finally, please be kind to your local healthcare worker. We're doing our best to care for you and our community. Thank you.